Approach to the patient with neurologic disease. References have been taken from Harrison Principle of Internal Medicine, Bradley, Neurology in Clinical Practice, Adams and Victor's Principle of Neurology. As we all know, nervous tissue makes up about 2% of the human body and supplied to all portions of the body. Neurologic diseases are common and costly. According to recent estimates by the World Health Organization, neurologic disorders affect over 1 billion people worldwide, constitutes 12% of global burden of disease and cause 14% of global deaths. Neurologic diagnosis is a correlation of data in the study of the human nervous system in health and disease. A synthesis of all the details obtained from history, examination, and ancillary studies. Taking a good history is not simple. It requires more skill and experience than performing a good neurologic examination. It takes time, diplomacy, kindness, patience, reserve, and a manner that conveys interest, understanding, and sympathy. All are essential. Importance of the neurologic examination in the diagnosis of diseases of nervous system cannot be overemphasized. In no other branch of medicine it is possible to build up a clinical picture so exact with regard to localization and pathologic anatomy as it is in neurology. How to approach? Let's see the first step. The first step should always to make an anatomical diagnosis. While taking chief complaint, always try to figure out or find out that what is the site of lesion. And for this, a detailed knowledge of anatomy of nervous system is essential. Now let us see the possible sites in the nervous system. Cerebral hemispheres, which includes cerebral cortex, internal capsule, connections of cerebral cortex and basal ganglia. Hypothalamus, pituitary gland, thalamus. These are also often the site of lesion. Brainstem includes midbrain, pons, medulla. Cerebellum. Membranes of the brain, that is the meninges, are also involved. For example, in meningitis. Ventricular system and the cerebral fluid circulation, for example, in hydrocephalus. Spinal cord is often the site of the lesion. The long ascending and descending pathways are involved, for example, in Pott's spine or transverse myelitis. In peripheral nerve, the site can be in anterior or posterior horn, plexus, or the nerve itself, and finally, a neuromuscular junction. Now, the second step. Once we are able to pinpoint the possible site of lesion, then find out what is the temporal course of the disease. And it is based on three things. The first one is onset, second is duration, and the third is nature of the disease. Now, based on onset and duration of symptoms and signs, there are 4 clinical conditions. If the symptoms and signs appear in seconds to minutes, the condition is sudden. If they appear in hours to days, it is acute condition. If they appear in days to weeks, it is subacute condition. And if it occurs in weeks to months, it is chronic condition. Based on nature of symptom and sign, there are 4: progressive, regressive, static, and recurrent. Now the third step, the important pathological diagnosis. If symptom and sign appear in seconds to minutes, that is, sudden. The possible causes are just two: trauma and vascular. If symptom and sign appear in hours to days, that is, the condition is acute, then the possible causes are vascular, demyelination, and infection. If symptoms and signs appear in days to weeks, that is, a subacute condition, then the possible causes are demyelination, infection, or the third one is neoplasm. If symptoms and signs appear in weeks to months, the condition is chronic and the possible causes are four: demyelination, neoplasm, degeneration, and rarely an infection. If symptom and sign appear on and off, the condition is recurrent and the possible causes are headache, epilepsy, pseudoseizure, multiple sclerosis, syncope. Now, what about laboratory tests? Where do they stand in neurology? A central goal of neurology is the prevention of disease because the brain changes induced by many neurologic diseases are irreversible. In the prevention of neurologic disease, the clinical method in itself is inadequate. Of necessity, one therefore resorts to two other approaches, namely the use of first genetic information and second laboratory screening tests. Shortcomings of the clinical method. Even after the most assiduous application of the clinical method and laboratory procedures, there are numerous patients whose diseases elude diagnosis. In such circumstances, we can often be aided by the following rules of thumb. The first one: focus the clinical analysis on the principal symptom and sign and avoid being distracted by minor signs and uncertain clinical data. Second, avoid early closure of diagnosis. Often, this is the result of premature fixation on some item in the history or examination, closing the mind to alternative diagnostic considerations. Third, when several of the main features of a disease in its classic form are lacking, an alternative diagnosis should always be entertained. Fourth, it is preferable to base diagnosis on one's experience with the dominant symptoms and signs and not on statistical analysis of the frequency of clinical phenomena. Fifth, whenever reasonable and safe, obtain tissue for examination. For this adds the certainty of histopathology to the clinical study. Keep on practicing wherever possible and develop the skill. Thank you.